Hi there, guys. Just wanted to pick up on quite a worrying article in The Guardian today, which outlines how measles cases are rising across the UK. So, if we have a look at the story here, it says that parents and experts have voiced alarm over rising measles cases, with nurseries bringing in COVID-style isolation protocols to clamp down on outbreaks. There have been more than 500 confirmed cases in England this year, and the majority of those in young children. And a child sadly died at Alderhay Hospital in Liverpool just this week past after contracting the infectious disease. And then it says, with cases increasing and vaccine uptake in some parts of the country worryingly low, nurses are bringing back infection control measures last used during COVID to keep children safe and ease parents' fears. And then interestingly, it says experts said that measles vaccine uptake had decreased in part because of misinformation online, missed appointments in the pandemic, and limited access to GP appointments. And then Helen Bedford, a professor of children's health at UCL, said inequality driven by poverty was the key underlying issue. So people talk about vaccine hesitancy, and that's true. People do have questions, they have concerns, but the biggest problem really is about access. Under-immunisation goes hand in hand with poverty. And then it talks about some of the reasons why that might be. So they say parents being unable to take time off work to get their child to a vaccination appointment, or being unable to afford the transport to get there, were regularly cited as reasons why children had not had both doses of the MMR jab. And then going further, Professor Matt Ashton, the Director of Public Health for Liverpool, said measles is a disease people are not used to seeing, and people have complex, difficult lives aligned to poverty and deprivation. They are time poor, often working really hard just to put food on the table. So that means they don't prioritise a health intervention for a disease they don't think is an issue. And then for some of the reasons as to why it's spreading so quickly, they go on and they say measles is 10 times more infectious than flu or COVID. So you only have to have a child sitting in a busy waiting room for 15 minutes and then you've got a potential spread. He said, this is Dr. Chris Bird, he said he was increasingly speaking to families who had not had their children vaccinated, often for personal reasons, which is worrying. And then they go on again to talk about some of the cultural issues perhaps, and how there's a need to take maybe a different approach for certain communities. So Dr. Kasim Malik says, we're often talking about people who probably have been traditionally excluded from accessing healthcare. For instance, the marginalisation of asylum seekers and refugees means they're more reluctant to seek out healthcare for their children. And then he says, at BEMA, we use inclusive language sensitive to the Muslim community, such as considering if there's gelatin in the vaccine. And then importantly, it says we need less demonisation and a kinder approach when looking at these issues by building relationships and looking at vaccine hesitancy alongside other issues such as lack of access to food and adequate housing. So in terms of what this means for us as a society, I just wanted to pick up on a couple of the themes in the article really. So firstly, there's the vaccine hesitancy, and then also I want to talk a little bit about the poverty aspect. So in terms of vaccine hesitancy, it's interesting that there's been a particular resurgence in this sort of post-COVID. Now, I was in West Africa during the Ebola outbreak at the end of 2014, and this has actually got some worrying parallels with what I saw there. So at the time of the Ebola outbreak, there was initially sort of denial that it existed, and there was a large subsection of society, particularly in rural areas. This is in like Sierra Leone, Liberia and Guinea. And people in the rural areas, they were blaming the outbreak on external forces such as governments or NGOs. And then there were cultural specific issues such as attributing the disease to supernatural causes like witchcraft. But then interestingly, you had sadly like whole communities that wiped out effectively because they were told, because they have certain burial practices in terms of when someone dies, they need to follow certain rituals. They continued to follow their own burial practices, even after being specifically told this is going to spread the infection. And the sad reality of that was that, as I said, whole villages were then wiped out because they continued to engage in their burial practices. And then, of course, in that context, it's similar to what we saw with COVID. There's industrial levels of misinformation being spread and conspiracy theories flying around. And that leads to persistent vaccine refusal, again, from a sort of sizable minority of the population. And that should worry anyone with an interest in the overall health of our population, because vaccines only work if you go above a certain threshold and enough people actually are protected from the disease. And then in terms of poverty, they talk in this story about how poverty exacerbates the issue. And that's also true for other preventable diseases. So we've had news over probably the last 10 or 15 years about the return of many Victorian diseases. So thinking of things like TB, rickets and malnutrition. And really that's just a damning indictment on our economic system. And it's the result of both years of government policy, which has directly led to poverty, but then also decay and neglect of the sort of social infrastructure in our society. Bringing those two themes together, the poverty and the vaccine hesitancy, it's indicative of the fact that the system that we've had in place since just after the Second World War, which is broadly speaking that the state will intervene to offer support to families and children via the health service and via the welfare state, that system is fraying, and we haven't yet got an alternative to replace it. And it also tells me that the shared bonds that contribute to a functioning society are fraying as well. So vaccination is a very visible manifestation of a collective endeavour to end disease. And yeah, if enough people don't have confidence in vaccines, refuse them for whatever reason, or lack the time or capacity to get vaccinations done, then that endangers every single person. And that's what the article was picking up there. So these are extremely worrying times, and it just sort of follows a trend that we saw initially in COVID, but seems to be continuing. So yeah, as I said, very worrying, and just wanted to pick up on that today. So thanks a lot for watching, guys. I'll see you next time.